Hi there, good morning. My name is Charles-Hosten. I am a consultant pharmacist and a risk manager, and today I'm going to share with you how I make thousands of dollars every month as a consultant pharmacist and how you may be able to do the same thing within 6 months or less. Let's get started. So, you have options, right? We all have options. If you do nothing to change your situation remains the same. And after I became a consultant pharmacist working with surgery centers, I realized that with all the potential I have, I was literally burning money by not taking advantage of the knowledge and abilities that I have to help surgery centers. Imagine how you would feel if you were able to make an extra $2,000 plus a month. You have at least an extra $2,000 coming your way every month. This income is consistent and predictable. That would be amazing, and that's how it's been for me. It's really helped me out a lot, but not only that, it's given me the ability to help others. I'm so much more engaged in my role as a business owner. I'm my own boss. Even though I still work full-time, I love my full-time job also. But just having my consultant business has given me the ability to expand myself and grow as a person. And again, this feeling of empowerment and being engaged with other business owners. If you decide to become a consultant pharmacist with surgery centers and would like for me to help you and show you how I did it, you will not be alone. When you choose to work with me, you will have my support every step of the way. What's in it for you, right? What I will tell you is it will change your life in all aspects. Again, this extra income that you'll make as a consultant pharmacist working with surgery centers, extra income monthly, that is guaranteed. The cool thing is you already have all the knowledge that you need, right? And by having this extra income, you'll be able to take more vacations with your family and your friends. If you're a new graduated pharmacy student, you'll be able to have extra money to pay off your student loan. It'll give you better financial stability to buy that car you want, maybe upgrade your life. It'll help you to save money for your children or your grandchildren's education. If, in my case, you have been a pharmacist for a while, and if you've been a pharmacist for a while and you now have grandchildren, that you can help them, right, and save for their education. And of course, the ability to put away more money for your retirement. So these are all really good options to have, and this can be yours by working with me and having me show you how to be a consultant pharmacist to a surgery center. Again, extra income, you already have the knowledge you need, more vacations, paying off your student loans, better financial stability, and the ability to put away more money for retirement. What I love about this business, it really gives me the opportunity to engage with other professionals, right? So I, as a consultant pharmacist, most of my career has been in the retail arena, and I really enjoy being a pharmacist. This is just what I love to do. But being a business owner and working with surgery centers, it helps me to connect with people on a different level. I love it because it's great to be needed and appreciated by the people you're serving. The staff at these surgery centers, they have so much respect for our profession. And when we show up and let them know we're there to support them and there to help them, they just love it. And for me, it's a real pleasure to work with them because they're really good people, and like I said, they're professionals like us, and just engaging with them is just a wonderful thing. So what exactly do we do in the ambulatory surgery center, right? So you manage medication. Um, I don't know if you're familiar with these surgery centers, but there's over 5,000 surgery centers in the United States. In Florida, where I live, we have about 500, and there are more coming on stream all the time. It's just one of the ways that our healthcare has evolved and has given people so many more options for getting their healthcare needs met. So in our typical pharmacy, we deal with patients with their medications, and this is what we do, right? In the surgery center, it's different. However, we're still dealing with patients, and in the surgery center arena, before a patient even comes in your door, they are usually called by the nurses, and the nurses will do a medication reconciliation. And so the patients will have to tell the nurses all the medications they're taking, because of course before surgery, certain medications, especially if the patient is on anti-coag therapy, those medications would have to be stopped, including aspirin or any of the non-steroidal anti-inflammatory medications. So again, I love to work with ASCs because they are the answer to growing healthcare needs. It's so easy if you need to have a colonoscopy schedule, if you need to have some type of a procedure that's non-urgent, you can schedule it and go in at your convenience and have the procedure done. I mean, so many different procedures are done in ASCs, from eye surgery, colonoscopy, ortho, certain gynecological procedures. I mean, just a plethora of procedures that are done in these ASC. They do spine, pain injections, and it's just an amazing opportunity for pharmacists like us who can go in and help them remain compliant. But we're also contributing to our health profession, but in a different way. So why are pharmacists needed in an ambulatory surgical center? Well, an ambulatory surgery center, again, is a great asset, right? I assist I assist them with their pharmaceutical services. So before these surgery centers can be open, they have to go through accreditation. They have to go through many inspections. And one of the things that are required are pharmaceutical services. Now, in certain states, they're not required to have a pharmacist. However, in the states of Florida and I think Texas, and I'm not sure of any other states, but these facilities actually need, in Florida where I am, a pharmacy license, right? So they have the permit they have is a institutional modified permit, and so they require consultant pharmacists to visit the facility once a month. I think in Texas it's every week, but I'm not 100% sure on that. If you're in Texas, you probably know, and you work with surgery centers, you probably know more about that than I do. But pharmaceutical services are really important no matter what state you live in where these surgery centers exist, because it is a requirement by Center for Medicare Services, right? They have to these ASCs have to have policies and procedures that govern the pharmaceutical services and medication management in the facility. And one of the most important roles of the consultant pharmacist in the ambulatory surgical center is to oversee controlled substance reconciliation process, and that can safeguard controlled substance and prevent drug diversion. And what a pharmacist can do is to help the facility set up systems that, another role is to help them set up systems that reduce medication errors, and of course especially medication errors involving high alert medications. And we'll talk about the high alert medications in just a bit. So what are pharmacy consultant services, right? So what we do is we help the facility create policies and procedures as to how they're going to monitor and treat the medications in the facility. And the policies and procedures are really important, and that can be from ordering all the way to administration to the patient. So in the ambulatory surgery center, each facility must have a formulary list, which are the drugs that they have in stock, and the medications that they have in stock should match the type of services that are offered. So like I have an example here. You would not have Botox in an endoscopy ASC unless it is a multi-specialty and they do these type of injections, right? But if you have a endoscopy center, mostly for GI, then you wouldn't have certain medications there because you just won't use them, and it's not in compliance with your scope of services. And so again, the pharmaceutical services. So we have the policy procedures, the list of formulary, pharmaceutical services, and that span like how the medications will be managed, procurement, ordering the medication, coming up with finding a supplier who could supply the medications. And another area is storage. Once those medications come in, how are we going to store them? How are we going to safeguard them? Number one, to ensure the integrity of the medication and to make sure that they are not stolen and that they are secure. So when we pull a medication to give to a patient, we know exactly what we're doing. And of course, drug diversion, to prevent drug diversion in these ambulatory surgery centers. So we'll just touch briefly on procurement. Again, procurement is getting the medication in. You want to make sure that you deal with reputable wholesalers. There was an issue, I know it's hard to believe, but there was an issue where people were repackaging medication and the medications were not the strength that they're supposed to be. So even though people were being treated with the medication, they were not authentic, and so a lot of people got hurt. So with procurement in Florida, each invoice of the medication has to have a pedigree of where that medication come from, like who was manufactured by, so it can always be traced back. And that keeps the medication, the chain supply safe, and make sure we are giving our patients the correct medication and the correct dose. And again, there has been counterfeit medication. I'm sure as pharmacists you've heard of that. And so the whole idea is to prevent that from happening. So procurement is really important. We want to make sure that we get the medication from a reputable supplier. And there are times when certain medications are unavailable during back order. And as a consultant pharmacist, we can be a resource to help the facility perhaps use an alternative medication that would give them the same result. Sometimes you do get the medication, but it's recalled. And so, of course, we need to help the facility set up a system where once they get the recall, how to check that the recall medication is not in stock and how to handle that whole process. And there are inherent risks in that. So procurement is huge. We want to make sure, just to recap, that we're using a reputable wholesaler, and that all medication have a pedigree to make sure that we don't have counterfeit or recalled medication in the facility. So these are all services that are needed and useful in these ASCs that as pharmacists we can provide. So there is a huge demand for our services. We are definitely needed in this environment. Another issue in the ASC is storage. Once these medication comes in, how are they stored, right? So you want to make sure that once a medication comes in, we have a good system to check in the medication, especially controlled drugs, that refrigerated medications stored in the refrigerator with a thermometer. So the temperature of the refrigerator should be monitored every day to ensure the integrity of the medication. And again, with the check-in process, control medication security, and further, those have to be under a double lock. Another huge thing, which I think is in the top 4 citation, is facilities having expired medication, which is really unsafe. I mean, I know that none of us would want to go for treatment at a facility and be given expired medication. So as a consultant pharmacist, we check for expired medication. But one of the things that I do, I tell the staff, listen, I want to be your second set of eyes. So I expect you here to check expiration dates. And when I come in, I will check again to ensure that if they are expired medication, that we are able to remove them from stock, and that they are not used inadvertently. Another helpful thing that we can do is, again, reinforcing the 5 rights of the medication, talking to the staff about always ensuring that the medication is given, when they drop a medication, it's given to the right patient, that it's given at the right time, and the frequency of administration, that the dose is correct, it's being given the right route, IV, IM, PO, and that we have the right drug. So make sure that they're following these 5 steps and let them tell you how they do it, right? Again, the medication administration process is really, really important in the ASC. And as pharmacists, we can ensure that the patient's getting the correct medication in the right dose and at the right time. So what are the inherent risks in medication management, right? Why do facilities need me? Why do they need you? Well, number one, they need us because we support their medication safety effort, right? We're there to support them if there's a question comes up, that if there's a question that comes up, they can call on you and say, hey, the other day I had a facility call me, and the question was, how long after we mix a medication in a syringe can we hold it, right? And so they felt confident that when they had someone to call to get that information because of USB 797 and the compounded laws. There is a 1 hour limit after medication is mixed that it should be given to the patient. And however, if it's in the OR, it's a whole different set of guidelines. Another good reason that we are needed in the ASC is we provide education to the staff. So they know, like, if there's a pharmacist handling medications is really, really important. And again, pharmaceutical services, huge. I mean, thousands of people die every year from medication errors. And as pharmacists, having a presence in these facilities, we can help prevent those errors by supporting them. So with high alert medication, we're talking about real problems here and real people, right? Sometimes people become stressed, they become overwhelmed, and it's so easy when you have all these files to, especially if they look alike, or sound alike, and remember, most injectable medications are clear liquids, right? So we really have to identify these haloid medications to make sure that they're not mixed up. So one of the things that I do, and I stress with my facilities that I work with, let's go ahead and identify those medications to ensure that that we don't make an error with the haloid medication. And then we have the lookalike, sound alike. So they have a list, all of my facilities, of the lookalike, sound alike. That's in their formularies, and they are also identified. Another huge area in the ASC is drug diversion, right? I'm sure you've seen stories on the news about people diverting medication, where they, some techs or even anesthesia physicians are injecting themselves, and so the patient who should be getting the medication is not. I have not had those issues, and I must tell you that the staff in ASCs, they are very much on the ball and great group of people. But people, sometimes you do have people who have issues, right? So the whole idea is to keep everyone honest and let them know that you are there, and they will think, and you have a good system in place, so they will think twice about trying to divert any medication. And that's a that's a huge patient safety issue if the patient's not getting the right medication. But again, you don't want to have impaired providers either taking care of the patients. So as a consultant pharmacist, we're there and we're monitoring things, and that in and of itself helps people realize, if they had the thought to do it, that they won't, because they know that we will know and they will be found out. And of course, you're visible there, right? So again, going back to that drug diversion slide, and the 5 rights, psychologically, when there's a consultant pharmacist available and on site and visible, the staff will know, hey, medication management is important, and let me double check. And of course, a constant education and your constant presence will really help the staff to be more diligent in their medication administration processes. And again, talking about the administration of medications, any medications that on site must be in the drug formulary, and you can help the facilities create those drug formulary. Order medication must be ordered by the medical staff member only, and the formulary list, if there are any changes to the formulary, it needs a doctor's approval to change. Making sure, again, that if the patient has an allergy medication, making sure that you help the facility create a system to identify patients' medication allergies. In some facilities that I work with, we do 2 things. We, once the patient states that they have an allergy, we put a sticker on their chart. We state what the allergy is and what their reaction is. That's actually required. And then we also put an allergy bracelet on them. So before we administer any medication, we check to make sure the medication they're about to receive, that they are not allergic to the medication. So NSAIDs is an area that there's some confusion, because a patient may say that they're allergic to ibuprofen. Well, then we don't want to give them any NSAIDs because of cross sensitivity, right? We wouldn't want to give them Celebrex or any type of NSAIDs that's in the facility. So we give them like something more like a Tylenol or a Tramadol for pain. Another way we can help the facilities in preparation of the medication, making sure that the area where the medication is prepared is uncluttered, so there's less error, less opportunity to make an error, right? And there are whole other ways of educating on preparation, but I won't go into this here. This will be for another video. And what can a consultant pharmacist do? Again, I think like I've said many times during this webinar, we can help support them. We want people to be safe in the medication process, and we can help support the facilities that need us and help them to take better care of their patients. So how do I educate the staff, right? So if you don't really want to wait till something bad happens, but bad things do happen in healthcare. So what we would do is, at the beginning of the tape, I also mentioned that I am a healthcare risk manager. And so I will get incidents of things that happen, and the way I handle those incidents. So in a consultant pharmacist case, let's say that medication error happened, right? How do we handle this situation? Well, number one, you want to educate. One of the things I do, I may do a 5-minute huddle. Remember, in these surgery centers, things move pretty quickly. Patients are in, patients are out, and they have to be monitored all the time by the staff member. So I would do like 5-minute huddles with them, just make sure I have the information that they need and I deliver it quickly, get a quick feedback, and then let them go. You just don't have the time to do that. But and then another thing we do is quarterly in-service with the staff, providing information, newsletters, again providing information. I do articles and I put them on the bulletin board, or sometimes I'll put them in a folder to provide staff education. Engagement, it's really important to be engaged. Remember, medication management is an integral part of the ASC operation. Again, education, and we can be a resource for the staff of these facilities. So what do you want, right? I just went through basically an overview of how we are needed in the ambulatory surgery center to help them with their pharmaceutical services. But what is the upside for us as consultant pharmacists? So number one, it can help you, give you extra money to pay off your student loan. It provides a second income. It gives you a plan B. Like I said, I work full time, but I have a plan B. If something happens, I can fall back on my consultant. I'm not left with zero income. If you don't have to work full time, you could just have your consultant business and just use that as extra income. As a consultant pharmacist, if you have a change in routine, you want to, if you want to practice pharmacy in a different way, that's an option. I mean, you can make extra money, you can buy a vacation home, have an exotic car. Remember, if you do nothing, right, a year from now, you'll be more tired, more frustrated. So I encourage you, if you're interested in starting your consultant business, the surgery center, get with me, because I did it from the ground up. Of course, I had mentors that helped me, and I'm very grateful for them. And even now, I do still reach out to them if I have a question. It is a learning process, and I'm here to help you. So my story is, been a pharmacist for 30, 35, 36 years. And my husband became blind about 8 years ago. And I became the primary provider for a family, right? So my full-time job that I had was just not bringing in enough income, as I had a young child in school. And so I decided I needed to make some extra income. And that's when I started my consulting company. Best decision I ever made. I felt upgraded in my quality of life, both professionally and personally. Now, with you, I don't know your specific situation, but imagine being able to have extra money to do the things you need, right? You'll have more freedom. You can take the vacations you want. You don't have to wait for something to happen. You can just be proactive and start your own company. You'll own your business, saving lives, right? You'll be growing yourself, feeling more self-confident, and feel good about your self-image. But most importantly, you'll be using the knowledge that we already have and helping people. It's not like the retail setting, but we'll still be helping people, but in a different way, right? As a pharmacist, we do care about saving lives. We want to have happy patients, right? Like this picture shows. So what I say is, I don't want to be a consultant pharmacist in name only, right? I want to be able to go out there and make a difference. And I know that you want the same thing. Um, I love the ambulatory surgical centers. I actually wrote an article, and I can send you the link for my article. It was published in the Florida Society for Healthcare Risk Management and Patient Safety newsletter. If you're interested in reading that article, I'll be happy to send you the link for it. And it's 5 facts risk managers should know about ASC. So I'm very proud of this article but it also shows my dedication to the profession, not only of pharmacy risk management, but also dedication to keep patients safe. And again, let's be a resource. It doesn't matter how many resources you have, right? If you don't know how to use them, it'll never be enough. So let's use our knowledge as pharmacists as a resource to help others. I'm here for you if you're interested in moving ahead and having your own pharmacy consultant business with serving surgery centers. I'm here to help motivate you, inspire you, coach you, be a mentor, and we can work together as a team as you grow your business. I really appreciate your time in being on this webinar with me. If you would like, I wrote a book. It's Medication Management in the Ambulatory Surgery Center. I'll be happy to send it to you. Just email me and it's yours. So again, thank you.